Hello.
Aloha mai kākou, everyone. Mahalo for joining us. My name is Lisa Leilani Ka'anoi from the Healthcare Workforce Development Center, known as Mauliola Ma Lama Lama at Papa'ola Lokahi, the Native Hawaiian Board of Health. So mahalo to those that are joining us right now and those who also will be joining us via the recording. So just to go over a few things, just to let you know that this is being recorded right now, and anyone who registered for this will receive the recording after. We'll send it out about 7 to 10 business days after today. And if you'd like to put your questions, comments, or feedback into the question and answer feature, or you can use the chat as well. And just for future reference, if there's you'll automatically be added to our email list if this is your first time joining us. And also, if there's a webinar that we have that you'd like to watch but are unable to because of your schedule, as long as you register for the webinar, you will receive the recording. And then at the end, there will be a survey that pops up. If you have the time, we would love to get your mana'o. This helps us figure out what webinars we should have in the future. And if you don't have time, it is Friday in the afternoon. We'll follow up on Monday to see if we can get any more feedback then. So mahalo. And I will go ahead and introduce one of our guest speakers is Dodie Revera. And she graduated from Hawaii Pacific University with a Bachelor of Science degree in 2007. In 2017, she graduated with her Master of Science in Nursing degree from University of Phoenix. Dodie has been with the Waiʻanae Coast Comprehensive Health Center for 13 years. She started with the health center as a community health nurse case manager in 2007 when she started working with a high-risk population and was trained on collecting enabling service data. She currently serves as the case management supervisor for our case management programs, which consists of homeless outreach and care coordination services. Dodie and the homeless outreach team provide homeless outreach services, primarily unsheltered homeless population. She's experienced in understanding the needs of the homeless population and ensures that the patients receive culturally appropriate, safe, and quality care. And Dodie, I'm going to add this to your bio. What is your favorite type of ice cream?
Oh, mint chocolate chip.
Mint chocolate chip. There you go. And that is Dodie. Next, we have Dr. Stephen Keone Young, who is a Native Hawaiian scholar and a recent graduate of UH Manoa Nursing's doctorate program, where he received an advanced practice register nursing degree as a family nurse practitioner. His final dissertation was on implementing surfing in groups to increase time of physical activity for Native Hawaiians. He went on to complete the Nale Kukui Nurse Practitioner Residency Program, where his passion for working with homeless Native Hawaiians allowed him to be the first resident to start rotating with the center's homeless outreach team. This led to a full-time position as a family nurse practitioner at the Waiʻanae Coast Comprehensive Health Center, where he is a provider for both their homeless outreach and school-based health clinics. And his favorite ice cream is Bubby's Mochi Strawberry Mochi Ice Cream. And there you have it. And so I will go ahead and turn it over to you guys.
All right, thank you, Lisa, for that introduction. I guess you can go ahead and open our screen share or presentation. We'll go ahead and begin. First off, thank you everyone for taking time from your busy schedule this Aloha Friday to be with us. We definitely appreciate your support and kokua, and in advance, we are thankful for hopefully some of your mana'o and help to help us improve our care here on the Waiʻanae Coast. So our presentation is going to be on healthcare to the homeless, presented by, I guess, Waiʻanae Coast Comprehensive Health Center, which we're affiliated with. I'm Keone Young, a nurse practitioner, and Dodie is...
And I'm Dodie Revera. I'm one of the nurses that go out with Keone. I'm the case management supervisor.
Okay, so this is a cool presentation. So our transitions are gonna be rough, but that's okay because it's just like the people of Waiʻanae.
Yeah, like the diamond in the rough. We just
Oh,
gotta
diamond in
polish
the
them
rough
up,
that we
right?
love.
Diamonds
You
in the
know,
rough.
and the rough things are what cause the things to be made smooth, you know?
Yep.
So here we go. Next slide, please. Okay, so that was a lovely rendition put together by Dodie to kind of illustrate and transition between the coastline of Waiʻanae. Its beautiful, majestic coastlines are also inhabited with or homeless population. And so as far as advancing to the next slide, a little bit about our center here at Waiʻanae Coast Comprehensive Health Center. It was founded in 1972 here on the Leeward Coast. And it is a nonprofit organization in which we focus on or disparities of addressing the needs for these populations to improve health, reduce health inequalities, and to do so despite their economical or cultural barriers. And so next slide, please. Okay, so our mission for our center here is a threefold, that being focused on healing, learning, and innovation. And so with it being a healing center, our goal is to provide accessible and affordable medical and traditional healing services with aloha. Also, we love to focus on learning. I'm fortunate to have benefit from this learning center with being able to participate in their residency, which offers health career training and ensures a better future for our community. We also like to focus on innovation, trying to use as best as we can the leading edge technology to deliver the highest quality of healthcare and services. Next. So some of these services include our school-based health clinics, case management, homeless outreach, behavioral health, care coordination, pharmacy, Native Hawaiian healing, substance abuse treatment, transportation, dentistry, WIC services, and along with our ER services, primary care clinics, which include family medicine, internal, pediatrics, and women's health, in addition to our imaging, which allows for radiology, mammography, and bone density screening. We also have vision care, adult care, and the next slide, please. Diabetes intervention, family planning, fitness gyms and programs, health education, health professional career training, health emergency liaisons, IRB, walk-in clinics, laboratory services, nutritional counseling, patient assistance services, perinatal case management, and of course, our infamous Kaha'aina Cafe, which has probably the best bread pudding around. And we're fortunate to have some specialists on campus for general surgery, cardiology, endocrinology, ophthalmology, optometry, obstetrics and gynecology, orthopedics, podiatry, psychiatry, psychology, dermatology, and chronic pain management. Next, please. Okay, so as far as today, our center sees over 33,000 patients and over 120,000 visits annually. And this is back in 2020, according to our patient profile. And we are celebrating our 50th anniversary this year, which we're fortunate to be able to do so. Next slide.
Okay, so thanks, Keone. I will be talking a little bit, give a little bit of a snapshot of community health services. So this is actually where homeless outreach and case management is housed. And in community health services, we have several programs that are under this umbrella. And I'm just going to go ahead and do a brief snapshot of these services. Next slide, please. So on this slide, these are all the services that are housed under Community Health Services Program. It's gonna give, again, like a quick snapshot. So our patient assistance services, we help the individuals or the community apply for our sliding fee scale if they don't have any insurance. We also help them apply for public assistance programs, which could be either financial or SNAP. They do the interpreting services. We also have our notary services in this program. And they also can help with the advanced healthcare directives. And I'm not sure if I said if they applied for MedQuest, but they also can help them apply for MedQuest. In regards for our women's health supportive services, this is what we call our perinatal program. This program is comprised of case managers that provide services and tracking with the prenatal, postpartum, and well baby patients. They also provide family planning and outreach. They also enroll patients into the breast and cervical cancer program if these patients don't have insurance. In regards to our care coordination program, so care coordination, just a quick highlight, care coordination is seen as a key to improving patient health and satisfaction and in controlling healthcare costs. So this program, it has a high touch, we use a high touch model where we have our care coordinators that provide intensive care coordination services to a targeted population to help them achieve their optimal wellness. And with that being said, they do a lot of symptom management, health education, and so forth in creating a service plan to help them move forward in their recovery. We also have the service coordinators that provides intensive case management services to high-risk patients referred by the PCP or other community provider within the health center. We also have our care enabling workers. They do the telephone follow-ups to reach out to the patients to ensure that they do timely follow-up after they were discharged from the hospital and or ER services. And we also have our transportation services that provide pickup for the patients at their home or on their beaches from Honokaihale to Makua to come back up to Waiʻanae and to also bring them back home. And last but not, last but is our homeless outreach case management services, which we will talk about in all of our other slides when we do the deeper dive, and you folks will know a little bit more about what we do in that program. Next slide, please. So our homeless outreach and case management program. So Waiʻanae has been providing homeless outreach since 1988 and case management services since 1994. The overall goal of the program is to outreach via a mobile van and provide healthcare services to the unsheltered, most vulnerable patients of the Waiʻanae Coast. And we provide services to individuals and families. The hopes is to reduce barriers to healthcare services by making available our services to them, which is case management, and to connect them to the resources that they need. Otherwise, if we were not able to reach out to them, these individuals will probably not be able to connect to the healthcare services and or community resources that they need. Next slide, please. I just wanted to share a little bit homeless stats. This is from the National Alliance to End Homelessness. If you're looking on this slide, based on the National Alliance to End Homelessness in Hawaii, there were 6,458 homeless individuals on a given night in 2020. So that is 45.6 persons per 10,000 people. I believe based on this data that we are in, Hawaii is in the top 5 of homelessness in homeless individuals. And if you look at this homeless stats also, you can see that there was a 6% increase from 2008 through 2020. Next slide, please.
Okay, so some of our patient demographics here on the Waiʻanae coast is that of that 33,000 patients we serve, about 16,000 or 48% is or are Hawaiian or part Hawaiian. Also, other Pacific Islanders is about 12% of that 33,000, with majority of it being Medicaid Quest patients. And then also our homeless is about 3%, so about 905 patients we see annually out of that pool. Next slide, please. So as far as our homeless outreach, the core components we focus on, of course, is an interdisciplinary team approach where we like to meet the client or patient where they are and then focus on building that relationship of trust with them. I think that's one of the hardest things is there's a lot of mistrust amongst them through whether it be through previous experiences in healthcare or having that stigmatism or and prejudgment. But the thing that I guess I do best is the gift of gab, which is engaging and talking story. So I mean, growing up on Oahu, mainly I grew up in town and I would drive to Makaha to surf and everything in between was just a blur. But now through outreach, I'm able to really get engaged and get to know there's more in between and there are families and people that are struggling. And so with that, we try to encourage motivational interviewing where we help them help themselves. They come up with the solutions and then we try our best to provide acute interventions while being culturally sensitive. And then we collaborate with our healthcare team and our other homeless care partners here on this side of the coast. And we strive to maintain a low barrier for them to continue their care. I mean, oftentimes patients get lost to care, but we try to reestablish that and make it easy for them to continue receiving whatever care they're willing to receive. And that's one of the most important things is I'm starting to learn we only can help them as much as they want to be helped. But us developing that relationship allows us to then provide more treatment and care. Next slide, please. And so some of the challenges identified, of course, is our chronic health conditions of diabetes, hypertension, chronic pain, asthma, mental illness. And with it, health is not on the forefront of these patients. They're just trying to survive. They're just trying to get through the day that the last thing they think about is caring about themselves. And so that's where we are able to step in as an outreach team and help them realize their importance and their need for that. And then with it, most oftentimes they are non-adherent with their medical appointments. They have increased risks for infections, limited access to running water, multiple open wounds, as you see pictured here, Dodie providing some wound care. And you'll see a lot of it, or we see a lot of wound care for sure. And then also multiple determinants of health, food insecurities, lack of transportation, lack of insurance, which our outreach team does a great job in trying to provide that bridge. Also, of course, severe mental illness and addictive behaviors and substance abuse is definitely not uncommon. Next slide, please.
So some of the homeless outreach services that we do to help meet these challenges that Keone just mentioned is we go out to the coastline on that white mobile van that we like to call Big Bertha. You know, it gets us to where we need to go and it does the job. So we do nursing care, medical assessments, and triage. Some of the nursing care that we do is blood pressure screenings, diabetes screenings, and like Keone said, a lot of wound care, health education, and flu shots. One of the things that I also wanted to mention, though, that through the pandemic, the outreach team continued to provide services to the homeless population, which also expanded to addressing COVID-related concerns, such as a lot of education on mask wearing, keeping the residents abreast of the news and the updates on what was going on with the COVID pandemic, because a lot of the unsheltered population, they had a lot of conspiracy theories, so we wanted to bring the truth to them so that they can make their own decisions and be safe and be aware. We also started, once we started getting the vaccines, we started administering the COVID vaccines to them, as well as administering COVID tests. And also in collaboration with the state and other homeless partners, the team was able to deliver hot meals to our homeless population, which according to the residents, they really appreciated this resource due to the shutdown of other resources, because once the pandemic was at full force, a lot of the resources that were providing food to our population, it just all shut down for safety reasons. So it was important that we continue to do that. We also provided the patient's hygiene items and donations. And one of the items that was gold at that time was masks and hand sanitizers. And the overall goal is to engage with the patients to assist them with establishing a medical home, as well as assessing and connecting the patients to the mental health and social resources available, such as establishing with a behavioral health provider. As Keone mentioned, a lot of our individuals out there, our residents out there, they have a lot of mental health issues. So if we can connect them with the behavioral health provider, that is just one baby step towards their recovery. We also complete the, I'm not sure if you folks are aware of it, but it's called the VI-SPDAT, or it's a vulnerable index risk assessment or screen that we complete with the patients to help them get into the coordinated entry system platform, so that they would be able to get connected to the appropriate housing that fits their needs. Next slide, please. These are some of the other services that we do. Sometimes the individuals, they don't have insurance. So we have funding that we can pay for their medications, because for the wound care, especially for the wound care, they need antibiotics in order to help get that bacteria out of their system so the wounds can heal. So that costs money. So we go ahead and pay for it. But in the meantime, we are also having them apply for medical insurance through our patient assistance services program. We also help them obtain their vital statistics, documents, birth certificate, social security card, state ID, because this is something that they need in order to get their permanent supportive housing through the CES process. And we also offer bus tickets to help the patients get to where they need to go. If our services, our transportation is closed up here, then we go ahead and give them a bus ticket to, transport them to where they need to go. And other provisions we provide is first aid kits and or medical supplies such as bacitration. Or now that Keone is with us, sometimes the patients, they like the itchy cream, which is the hydrocortisone. So before we couldn't provide that, but now we can if Keone is with us, because he can just give us the order, yeah? Next slide, please. So I wanted to talk about this quick case scenario. So just to paint the picture of some of the residents that we serve out there. So this scenario, it's 2 adults and 3 children. They're chronically homeless since 2007. The reason for their homelessness was they wasn't able to afford their rent. They were established here at Waiʻanae. However, they had a lot of no-shows and a lot of cancellations. The wife had a history of major depression. Both parents were actively using, and there were also history of domestic violence. So some of the barriers were the animals and their need for documentation, because as I mentioned before, in order for them to get into the housing platform, they needed to get their birth certificate, social security number, and state ID. So what was some of the interventions? Some of the interventions that worked for this family was that we continued to actively engage with the family to encourage their wellness, to encourage them to, if they need their appointments, that we'll schedule their appointments, we'll follow up with them. We went down there to give them appointment reminders. We did transportation services. So it was that ongoing connection. We also helped them with their housing and shelter options. We went over some of the options. what did they want? You know, they refuse to go into transitional shelter. They've been there before. They don't want to go back there. So we focus on permanent supportive housing in regards to helping them get all of their documents in place, as well as helping them to get reestablished back with Waiʻanae. So one of the keys to have this patient move forward was the persistent contact and the persistent follow-ups, and using, you know, all the MI techniques that was in our toolbox to help them help themselves, you know, to help them make the plan of action, and then just be there as a support to help them move forward. So the outcomes for this patient was they were able to establish care. They scheduled their appointments, they kept their appointments via transportation. They also obtained their IDs, birth certificate, social security card, and they were linked with the Housing First Agency, and they received their housing in August 21, 2017. But, you know, looking back right now, it's unfortunate that they were in their house maybe about a year, 2 years. And right now they're back homeless again. You know, unfortunately, we do have the Housing First is a model where they do have supportive services in place. But again, one of the reasons they were homeless was because they couldn't afford their rent. So therefore, whatever services was in place, unfortunately, the resources was lacking and they wasn't able to afford their rent. So it's like a ping pong, yeah, a revolving door. So they're back up homeless again, and then we try to assist them as much as they let us, Next slide, please.
Okay, so as far as providing healthcare for the homeless, the National Healthcare for Homeless Council defines street medicine as the practice of providing medical care to unsheltered people experiencing homelessness in locations like encampments, parks, and under bridges. They forgot to put beaches, so I'm going to coin this as beach medicine. But maybe I can prescribe surfing. I'm sure it would help. Next slide, please.
That might be real therapeutic.
Hey, it worked for me. That's fine. Stay sane, you know. Sometimes my wife thinks I have too much of that medicine, I guess. But we'll carry on.
Okay.
Okay, so the types of patients that we see for beach medicine is complex patients with comorbidities, as we previously mentioned, substance abuse, mental health, chronic conditions. Most oftentimes they've been lost in care, with that being they haven't seen their PCPs in years. They don't even know who they are, let alone know where to get it or get that care. And so it's kind of funny as far as us doing outreach. Here in this picture, this is actually at the Waiʻanae Boat Harbor, where we set up this pop-up clinic. And if you notice, there's this pallet fence behind. It kind of wraps around the whole, I guess, southern side of the encampment. And they have like security guards there that are stationed, that are, of course, residents. But I remember there was a provider that wanted me to find a patient at the Waiʻanae Harbor, and I was given the name, and I didn't know who that was, of course, being so new to this type of care. So I asked Dodie, hey, who's so and so? And she's like, oh, that's the lady right over there. And so the beauty of it is that we provide that opportunity to help them that are lost be found in getting back into the care program, our healthcare program. We were able to connect that patient back with their PCP for their uncontrolled diabetes. I think they're like A1C was like it was 13 or higher, but with it, she didn't have a way of being contacted, no cell phone or anything. So fortunately, this kind of illustrates how the benefit of being able to do this street beach medicine. And of course, a lot of these patients are non-adherent. Most oftentimes it's because of not trusting Western medicine or having that distrust because of feeling judged. And granted, there are stigmatisms that come with their lifestyle, but with it, it comes to us trying to do our best to provide that compassion and overlook that, and do the best despite the repetition of it. Like Dodie said, we see the cycle, the highs and the lows, but hopefully we're able to get them in a better state. And then with that, we do see a lot of patients for discharge follow-ups. One that I was talking with Dodie about as well was a patient that I guess she had like MRSA in her scalp, and ended up getting pretty bad, where she had like 3 or 4 drainage tubes in her neck to kind of keep it getting all that fluid out, and was discharged into a skilled nursing facility where I believe she left AMA and was hopping around to her like family's house, and there was a big fight there. So she ended up back on the beach with a ex-partner, where we just so happened to be at the right place at the right time in that sense, because they just had a big beef. Like, talking about rough people, oh, they was like scrapping, stuff flying all over the place, and we show up and we're trying to like diffuse the situation as best as we can. So we were able to separate them and get their belongings for the patient out, so that she could get seen by EMS, which is another story. But with it, in the middle of this fight, the partner is actively trying to commit suicide with a belt on her neck. I don't know if it was just for dramatic effect for the fight, but we were like engaged in this, and I'm like, what did I get myself into? This is like beyond my pay grade. but with it, you definitely come to learn to love it, and it's always exciting. You never know what you're going to experience in outreach, which is fun. And next slide, please. And so as far as our medical care visits, they are structured similar to office visits, just with a better view, most oftentimes. Where there is a chief complaint, our nursing support does do assessments and gather vitals and other information, where we're then able to then see them. Ideally 15 to 30 minutes.
Ideally, but you know, Keone, he gets the gift of gab, yeah?
I laugh at that. Hey, you know what, Dodie? I'm trying to build a trust relationship with these patients, which is always like, hurry up, Keone, hurry up. Hey, don't worry. Don't let us come back. But that's the main thing, right? Is to establish that relationship, so they do allow us back. They do trust us. And then because of that trust, they're willing to then accept the treatments and then hopefully continue them to better their health outcome. And so usually the beauty of it is, because of this bridge in relationship with outreach and a provider, is that we're able to coordinate care after, whether it be their treatment plan, getting them connected with appointments, transportation, referrals. We have it all right there, and most oftentimes it's hard to find them. And that's why a lot of the pictures to come, you'll see us pulling our carts, because most of the time we're just trying to find patients that are trying to get follow-up with or get reconnected with care. And so we also do home visits with our outreach nurses, and the majority of our care is wound care, health education, medication refills and delivery, and then assisting with follow-ups with establishing care, referrals, getting them the medical equipment that they need, and also that transportation, which helps so that the no-show rate is a little better. You know, I mean, it's a tough population to deal with. But next slide, please. And so these are just some of the pictures of us hunting for those patients, as you can see along the coastline, and being able to see them. And that's the neatest thing is, I mean, most oftentimes driving along Waiʻanae Road, you just drive by the tents and you see it and you're like, oh, but it's different to be in it, and to be in that sense, it's sacred that they allow us to then come in. I mean, I remember along Waiʻanae Beach, we saw a patient that he literally let me come into his tent. I mean, there is, of course, safety issues. Dodie was right around the corner, but with it, building that trust so that they would allow me even to be in that safe space that they feel is, even though we know it's tough, it's not as safe as we're fortunate to have with homes. And so, as you can see, we see patients for all sorts of things. This patient here, she had uncontrolled diabetes, and with the struggle of being able to store her medication and insulin, yeah, she does have a lot of foot ulcerations. Fortunately, these were mostly pretty clean and didn't seem too infected, but we were able to then get her set up with podiatry and wound care and get her a new PCP to establish with. Next slide, please. And so the benefits of homeless outreach and medical care without walls or beach medicine is that it slowly and hopefully provides that behavioral change, right? We like to focus on promoting health activities as well, in addition to providing that autonomy for them. They feel safer in their encampments or in their homes or tents, which then allow us to help them not have that barrier up or that wall in receiving treatment or care. Oftentimes it is nice to see that they are a lot more comfortable and open. And then we like to effectively or efficiently utilize healthcare and community resources as a preventative measure as much as we can, in addition to keeping them in the loop with their healthcare, keeping them or allowing them to have the autonomy to have shared decision making, and then with, of course, with us. And then that's the thing is, like, you only really can help them as much as they want to be helped, but hopefully them seeing you care allows them to think, okay, maybe I do need to take better care of myself. Maybe I do need to make those lifestyle modifications and changes to better my health and hopefully their situation. And so with it, we always promote moving towards a positive patient experience as best as we can while improving access to care and reducing harm. Next slide. Okay, and then so this is actually what I was talking about, that pallet fence that they have at the Waiʻanae boat harbor. And I was always driving by and I was curious, like, oh, what's it like in there? And now I get to be in there, and I feel it as an honor to be able to provide healthcare to this population. And so it's really organized, actually. Oftentimes they have assignments or I guess housekeeping things they need to do, whether it be security, clearing out empty lots, because it's kind of broken up geographically in there as well, in addition to running the donation center. I remember having a patient where they needed actually a doctor's note to do light duty. And it's that organized that it's like that. So it's pretty cool. Next slide.
We do have a question.
Oh yes, questions. I defer to Dodie.
No, it's okay. So I love the street medicine and taking it to the homeless patients. I understand sometimes patients are skeptical about going into the doctor's office. For those you provided care outside the clinic, do you notice any increase of medical adherence, following up with referrals, building that trust with providers, etc.? Yeah, actually, if you turn to the next slide, there's actually, this might answer the question, I think, possibly. Is this brought over here? I think us establishing that, he didn't see a PCP for, I think his last record was like back in 2007 or something.
Yeah, a long time.
Yeah, it's been a while, and he has hypertension, and so we were able to start him on his medications. Of course, he ran out and didn't go to get his refill, but I'm hoping that because of that relationship, even though this is like, we don't want him to do this, he started taking his white blood pressure meds, so at least he's trying, you know. And so I'm hoping that we are creating that change and that hope to allow that trust for them to take the medications, even if it's their wife's. But we got him refilled at this visit, and he's hopefully working on that to modify his life. Yeah.
And then to piggyback on what Keone was mentioning, yeah, we do see patients that, you know, when we go up there, because Keone does all the acute care. So we do have some patients that, oh, they don't like even come in. They only like wait for Keone. So we come out there and we see them. But there are some patients that has come in, has established primary care at our Waiʻanae clinic. And we are working and tracking these individuals to help them with their specialists. Like there's one patient that he has really bad high blood pressure. You know how I'm talking about, Keone? His blood pressure was, I don't know, every time was like almost 180 over 100 something, sleep apnea. And we scheduled him an appointment, and then he came to draw labs. So we printed out the labs. We went down there. Keone reviewed the labs with him. And then we asked him that he needed to come back to his primary care. So he did. He came up to his primary care. The primary care did the referral back to his cardiologist. And then we're tracking that referral and the referral to his sleep apnea. So that's what we're doing right now. So, you know, it comes in small bursts, but we take it, right? You know, we take it one step at a time.
Okay, we do have another question. Thank you for all you do for this community. Does your outreach also partner with faith-based organizations?
So in regards to faith-based organizations, if an individual, because majority of what we do is we go out there and we provide outreach services. We do partner with a lot of organizations, and some of them can be faith-based. So in the past, we have partnered with faith-based organizations in regards to them providing us hygiene items. But then the pandemic hit. So a lot of the resources or the faith-based resources that we had in our toolbox, you know, we have to go through it again to see which partners are still actively doing outreach.
All right, mahalo. And then we have, what are the impacts of capitalism, white supremacy, military occupation, and colonization on the prevalence of and healthcare for the unhoused population of Hawaii?
Now let Keone answer that.
That's a loaded question.
Yes,
That is a loaded question.
I mean, I'm gonna defer to surfing.
Yeah.
Because even surfing on the west side, there is that that separation of your skin color in that sense, where there is apprehension, right? There is mistrust. There is that struggle, and granted. I know the director of the residency, she was apprehensive of other people in the past that have tried to get engaged with homeless outreach, until I guess she felt that I was a worthy candidate to be able to build those relationships, and hopefully overcome that mistrust. I don't know if that answered the question. Was that kind of within the realm, or was there more to that question? I can't recall. My favorite line, I can't recall.
That's a whole nother webinar. There's another question. Are there protection, and don't worry, I'll pull up your last slides after these.
Okay, no worries.
Are there protection and social services for keiki and kupuna who are in vulnerable or abusive situations?
Yeah, so as far as protection, when we go out there, because we're mandated providers, in the event that we see that there are abuse or neglect going on, that we would definitely call the appropriate services. So for adults, that would be Adult Protective Services. For child and family, that would be Child Protective Services. But one thing I wanted to highlight, you know, we always let our residents know that we're not the police. So we're not there to turn them in and to you know, take away their kids or to put somebody in one facility. That's not what we do. What we do is we go out there and we provide them support and assistance to help them move forward in their recovery, whether it's housing or to help them stabilize in their medical conditions. However, if there is abuse going on, that we will come in, because we do get calls from the community. I mean, I remember this one. We had a call We got several calls for this baby, that they thought that the baby was undernourished, that they thought that the parents was not doing what the parents supposed to be doing. You know, we went out there. We know this family. Every time we go out there, we always see the baby. Baby no bruises on them. Baby looks like it's thriving. Now, baby was a preemie. So it is, to me as a nurse, it is the baby not gonna have, you know, all fat and rolls like a normal baby because it's a preemie. You know, it's gonna take some time. So the community called, the community is the homeless community. They kept calling us. The doctors called us. So we went out there several times and we always did a report. Everything looks good. You know, the baby looks good. Mama looks good. We even helped them to come back to their appointment because that's how concerned the primary care provider was. We went down there, made sure that they got their appointment, waiting for them to get onto the Waiʻanae Comp van to come to their appointment, and then they came to see us. So today, fast forward today, the baby is thriving. The baby is thriving. The baby is currently living with the grandma, which was the plan though, which was the overall plan, but the mama, the parent, never want the baby to go live with grandma at that time. So we was just there to support. So, but that was the overall plan because the grandparents was heavily involved with this child. So right now the baby is living with with grandma, and the couple, they're still, you know, living their life, their choice of still being homeless. And then hopefully one day, you know, with us keep coming out there, they'll decide that they want to go and seek shelter. But yeah, it's a good question.
Mahalo. Another one is, does your outreach accept volunteers to help with manpower?
Yeah, if anybody want to volunteer, you know, they can go ahead and give me a call, and then I can talk to them about the logistics of it.
Great. Oh, you got a compliment. Hi, Dodie and Keone. Love sitting on this panel with you folks. Great presentation.
Hi, Camille. She was one of our outreach workers before.
Oh, nice. Okay, so I'll go back to your slides.
Okay, you can go to the next one, actually. Thank you.
Yeah, so talking about lessons learned along the way. So Keone and I, you know, we put this together as the highlights. I mean, there's a lot of lessons that was learned, but you know, that would take us like forever, probably 2 hours. so we just kind of broke it down and just did the most highlights. So one of them is definitely we need to take a holistic, patient-centered approach. That is the main thing in order to build those relationships of trust. Yeah, so that's one of those biggest lessons. We need to actively listen to them, let them tell their story. Be genuine in our responses, in our approach. We want to make sure that we're empowering the patients, making them have that control, and not us telling them what to do or scolding them. A lot of our techniques are harm reduction, even if they're addicted to meth. You know, we don't tell them to stop meth. Oh, maybe you can smoke one less day. You know, just smoke one less day. Yeah, so, you know, those are the things that we do. And then right now, you know, we're trying to gather the data in regards to what we're doing, like all the complex patients, what is the complexities in regards to their medical conditions, to see, hopefully, you know, the trajectory of where they were at when we first met them. And then when, you know, another year later down the road, you know, where they're at right now, you know, to see the improvement or no improvement, so we can come back and look at what we're doing and see how we can make it better. The other thing is persistent follow-ups. That is so important. One of the things is, if we tell them that we're going to be there, we better be there, because we tell our patients that we're going to be there, they're waiting for us. And if we don't come, when we come back the next time, they're going to say, how come you guys never come? Where you guys was waiting, you know? So that kind of breaks down the trust a little bit. No, for us, it's a little bit, but for them, it's a lot. So Yeah, so we always got to make sure about that. And one of the biggest things that, in my experience in doing this, you need a medical champion. You need a medical champion. Keone is our medical champion because in the past, we had students, we had doctorate students and nursing students that was, doing their APRN. But there was a big challenge in that because they couldn't do an assessment with the patient. They couldn't write the prescriptions. These students were doing like what we were doing, but we were missing the link of the actual assessment and the actual orders and everything that is structured as in the office visit. So with Keone, that would bridge the gap. That's exactly what we needed. So these are pretty much the highlights of our program in regards to the lessons learned. Next slide, please.
All right, so these are just some pictures of our current mobile medical clinic here. These ones again at the boat harbor where we do have a lot of patients. And we kind of, in this bottom right corner, we kind of started off with like a pop-up tent that we would actually have like an outdoor clinic kind of thing. But it was better for us to go to them rather than trying to pull them out of the encampment. And so we don't do that one as much, but we're in hopes to maybe do a mobile vehicle of some sort, right?
Yeah, hopefully soon.
Hopefully. Yeah, you. Okay, next slide here. So just again, more pictures of our visits, our little cart that we carry around, our medical bag, wound care, and I love this picture on the right of Dodie. Raw, rain or shine, broken ankle or not, there goes Dodie pulling her bag to go.
Oh, you're so funny.
So I'm grateful for her example on having that compassion and that sacrifice to do this type of work. Another story that comes to mind with Dodie was, I remember we just went to Foodland to grab lunch, and we were across Sewers Beach there in Waiʻanae, and in the parking lot we stopped by, and I think we were supposed to see a patient there, but it was a no-show, unfortunately. But with it, I remember there was another homeless person just sitting there, and Dodie sparked up a conversation and ended up giving him her lunch. I was like, oh, mean, okay, one day I'll get to that point, but I'm gonna eat my poke right now. But thank you, Dodie, for that. Next slide. And so this is our last case scenario. This one hits home for me because it was a game changer for me. This was a 69-year-old female, somewhat single. Her boyfriend came and went, and she didn't have any social support or family support. The patient was homeless for over 10 years, and at the time there was a relationship established with Waiʻanae. I know Dodie was seeing her when she was living in her van, but her health deteriorated with her chronic conditions, like you see, amphetamine abuse, incontinence, tobacco abuse, diabetes, circulatory problems, major depression, COPD, and DVTs. And throughout the patient's homeless, she continued to refuse the sheltered services until we were able to build that relationship. And the outcome of it was that she was able to get permanent housing through or care and through her visits. But the big thing that was a game changer for me was it was kind of one of my first visits, home visits, after successfully seeing this individual get housing, was at her home. She needed follow-up after being discharged. And the thing that after kind of towards the end of doing my assessment and visit, she looked at me kind of teary-eyed, and I wrote this down. I'm going to say this word for word because this is what she told me. She said, "Why am I so special that you would come out to see me? I'm nobody." And that one hit me. I'm like, whoa. These patients don't have that self-esteem. They don't have that love or care or compassion that hopefully we can provide a little bit of to help them better their situation. And so that kind of helped me see that man, these people are somebody's, right? And they do deserve the care despite their lifestyle, despite their addictions, despite their weaknesses. And so, yeah, this one really was a heart-to-heart important one for me to continue this. And then next slide. And lastly, in regards to living eola pono, which is striving to live with right intentions, actions, relationships in order to thrive respectfully and harmoniously within our communities. This is a model in the sense that our health center here at Waiʻanae Coast Comprehensive strives to follow, is really just doing what's right, especially at the right time and the right place, in order to better a community that has gone through much trauma, and that is going through continuously, as you can see with the different struggles we see with families, the domestic violence, substance abuse, lack of jobs, inability to pay rent. Let's do what's right to try help them, and to try and our best to share compassion and love. And so I think the next slide is
Paul.
Makaha Beach, where I do a lot of medical care for myself. And it was funny going to Makaha, they're like, "Oh, who's this guy surfing out here?" And to then have some of them become my patients, and then to build a relationship, it's unfortunately for my wife almost like a second home.
That's wonderful. Dodie, would you be interested in sharing your contact information so folks can reach out to you if they want to help and volunteer?
Yeah, I'll go ahead and send it to you, and then you can go ahead and post it. Is that okay?
Yeah, that's totally fine.
Okay.
And then we also got a comment about you are both angels on the beach, mahalo nui. I think we all feel the camaraderie you two have. And I think, I was sitting here listening to you both, that probably also has some effect on the patients that you see, right? So they see the relationship that you have and it puts them at ease, right? And especially for as long as you guys have been out there, right? Because they're used to people coming in and out of their lives, right? And it's a new person. And so I just really feel like your story is really special in that both of you get along, both of you have the same passion, and that you guys have been there forever, and all the patients just like know you like their family, right? So I just think it's incredible, and I just want to mahalo you both for sharing today and spending time with us today. It is 2:57, and we can still take questions, comments, if anybody wanted to reach out.
Oh, Dodie, first time we on time.
You got that right. Yeah, normally we're running always late, but we'll be there though. We'll get there.
Yeah. Hey, we're on the right track.
Maybe you'll get some ice cream today.
Let's go.
Yeah, thank you guys so much. Thank you. We really appreciate, you folks sitting in, and like Keone said, taking time out of your Aloha Friday so that we could, present and you guys can hear our story and what we do on the West Side. Thank you guys.
I do want to have I'm curious. So how do you guys are experienced in this, have been doing this for years. You obviously, like Keone, for you, your release is to go surfing, right? How do you self-care, like after you see these folks and you kind of have your heart breaks, right? How do you not carry that bring that home, right? And
it's kind of interesting. My wife definitely can attest to this. My memory is so bad. So I think sometimes it's a weakness, but then sometimes it's a strength because I don't allow myself to hold on to the things that we see or the struggles that are out there that allows me to just kind of continue on. So oftentimes or sometimes our weaknesses can be strengths. So it helps to not remember and hold on to the trauma too much.
Right. How about you, Dodie?
Yeah, I'm the same as Keone. My memory is worse than Keone's. So, I see what they're doing. I'm very passionate in what I see, and I walk in their shoes. I put myself in their shoes. But at the end of the day, everything is diffused. I don't carry it with me. go home, watch my Netflix, relax, and then that's it. And then come back and be passionate again for what I do. Yeah, I don't carry it. I think that's the biggest thing, because then we can get burnt. Yeah, we can get caregiver burnout. So if you have that coping mechanism of diffusing it and not carrying it on, then it makes your overall wellness become better. Yeah.
Mahalo nui. Mother Teresa smiling on both of you. I just again want to thank everyone. The next webinar is coming up is on March 13th. For those that are, or May, for those of you that are new, we have webinars twice a month on the second and fourth Fridays, or no, is it the second? Yeah, the second and fourth Fridays of the month, unless it's a holiday. And the next one is going to be May 13th, and it's going to be with Ginny Wright. She's going to be talking about raising disabled children. So kind of along the themes of Mother's Day next month. So you will get an announcement, but just malama pono and aloha kekahi, and I'll keep in touch with everyone. And then also if Dodie and Keone, if you could hang on just a little bit longer, we can debrief after. So, but everybody have a great weekend. Aloha, hui ho.
Thank you.